Hello, everybody. I'm super excited to be here. For those who are looking for Rudy, Rudy is behind the scenes tonight. I am Brandon Johnson. I will be hosting our conversation tonight. Our topic is fighting while healing, dismantling systemic racism to improve Black mental health. And so I have a lovely set of people and panelists with me here today, and I'm super excited about the conversation that's going to take place. We find ourselves in a really interesting time in society where we're really beginning to unpack and really look at issues around systemic racism, discrimination in our society in a number of different facets. And so as we look at this, and we've all seen what happened with George Floyd and the countless other individuals who have been impacted by systemic racism, those who we know, those who we hashtag, those who we lost, and many of us who have experienced it that aren't household names. It continues to be a prevalent problem in our society. And what is a result of that there are impacts, mental health impacts on Black mental health with Black people in particular. And so tonight, what we intend to do is to really unpack this across a number of different levels. I have my esteemed guests with me tonight. We're going to really dig into a few questions and really dive into this conversation to unpack this as a field, as in our workplaces, as individuals, and really see how we can break down and start to see the impact of some of this systemic racism, talk about healing, and talk about how we move forward. Like, how do we all address these things in areas that we have impact, that we have influence, and how do we really use our voices in the best way possible to give our voice and lend our voices to people who historically haven't had their voices heard. And so we're going to try to do this in an hour. So wish us luck. We're going to try to get through as much of this as possible. But for right now, what I want to do, I want to get into introducing, having the panelists introduce themselves before we jump into some questions. We'll have some things coming through on the chat and some questions popping out for you all that are watching this. And so we really want you all to take the opportunity to share with us anything that you are thinking around this topic, things that you've experienced, things that you're committing to help break down these systems. Because if we can talk about them all day, but if we don't work to unpack them and break them down, the impacts are still going to follow through generation after generation. So with that being said, I'm going to call out our esteemed panelists and have you all introduce yourselves. And so I'm going to throw it and have Kyle kick it off.
Hi, everybody. I'm Dr. Kyle Berkley. I'm a mental health therapist at Healthcare for the Homeless and at Arundel County Crisis Response. Also serve at the leisure of the state on a Baltimore City State Central Committee as well.
Thanks, Kyle. Glad to have you here. Adam, go with you.
Good evening, everyone. My name is Adam Johnson. I'm the Family Services Program Manager at Roberta's House. It is an African-American grief counseling center in Baltimore City.
Thank you. Imadé?
Hey, I'm Imadé. I'm a writer and a mental health advocate. I live with clinical depression and borderline personality disorder. I'm also a suicide attempt survivor, and I founded Depressed While Black. It is an online community, and it's also a charitable initiative that donates Black-affirming personal care items to mental hospital patients.
Awesome. Tichianaa?
Hello, I am a physician, a wife, mother of two, born and bred in New York City. I'm a practicing psychiatrist and medical director and vice president of behavioral health at the Community Health Center, which is a large federally qualified health survey center serving over 100,000 patients throughout the state of Connecticut, but also with a national presence. I'm also the assistant clinical professor at Yale in the Department of Psychiatry, supervising and active in our social justice and health equity curriculum and advocacy track. And I've worked closely with my local churches in health and mental health awareness efforts throughout the years.
Awesome. And last but not least, Chanda.
Good evening, everybody. My name is Dr. Chanda. I'm a postdoctoral fellow at an institution affiliated with Johns Hopkins. I do child and family therapy there. I also founded the Minds of the Culture mobile app, which is an app specifically related to Black mental health, as well as emphasizing the importance of faith and mental health and just really helping people to understand that there is room for both. So I really love operating in that space. So yeah, that's me.
Awesome. Well, thank you all for being here. I appreciate each of you all spending your time and your experiences and your expertise here as well. And so myself, I'm Brandon Johnson, graduate of the illustrious Morgan State University and Johns Hopkins School of Public Health. I've worked in suicide prevention for about 7 years now, former director of suicide and violence prevention, currently still doing some work in suicide prevention. But since I'm not representing that agency tonight, I will not be talking from that vantage point. But I've worked in Black mental health and community work, and also do lead initiative on faith communities and suicide prevention as well. So I'm excited to be here. Okay, so let's hop into our conversation for tonight. And so just to kind of kick it off, we talked about where we are as a society, where we currently find ourselves in. And so whoever, as much as you're comfortable, if you all could talk about how the current environment between COVID-19 and some of the unrest and uprising we see happening in our country, how do you all see, how have you all been impacted personally, as much as you're comfortable sharing, and how have you seen this environment impacting other Black people?
I'm happy to jump in. I've really become accustomed to saying that we are in the midst of two pandemics, right? The COVID-19 pandemic, also racial violence and injustice pandemic. But recently I was talking to Dr. David Williams, and he pointed out to me that there's really a third pandemic that people are really coping with right now, with the economic crisis as well. So, there are so many things that we have sort of on top of us right now. But what I've seen is that because I care for patients from all races, regardless of ability to pay, is that the impact of each of these has really been especially devastating for my Black patients. And some of the evidence really does corroborate that. For one thing, my Black patients really have lost family members and dear close friends in numbers that my other patients just really haven't. They are very wary of who's next. There's a great deal of fear and anxiety, and also just a deep sadness, but also resilience, and sort of trying to lift one another up through this. I personally did lose my godmother's mother, and my godmother has been really a prominent figure in my life and in my children's lives. But at the early stages of this pandemic, we lost her mom, who I adored. And I found myself really in the midst of trying to help our clinicians work remotely, support my patients that I see, and in these, really unprecedented times, and also trying to hold it together emotionally myself. And so one of the things that was really, and I'm sorry, are you getting feedback or is it just me?
Oh no, I'm good.
You're hearing me good? Okay, sorry. So, one of the earliest memories of this whole situation and ordeal for me was trying to call funeral home after funeral home who said they didn't have room. And also having pressure from the morgue telling us that we had to get her removed, and having a deadline for that. So it was an emotionally trying time, and really just trying to navigate all of that while trying to help other people navigate it was incredible. But it was a strong example of what a lot of the Black patients that I have were also up against. Right. And so since then, we've lost about 3 other people in the family as well. So this is something that really has had a tremendous impact. But then on those other two pandemics, right? So we already had known pre-existing wealth gaps. So the loss of income has been a huge burden on my Black patients. With us already low on intergenerational wealth in the first place, as well as just low on information and knowledge about direction and how to improve our financial situations in general, even in good times. So, many are concerned that they won't have food on the table. And when, the landlords come knocking to collect on rent, that, they can't evict them now, there is a rising tension and a rising anxiety about what's going to happen in the next couple of months. And finally, obviously, racial injustice, right? The profound impact has really been a stark contrast. So I'll just give you one example. I have a group that I run. Mind, body, food. So we look at mindfulness-based meditation. We do all of these things around nutrition and mindfulness-based meditation. And I have it's predominantly Black patients, but I also have white patients. And the difference in how they sort of came into the group after we lost George Floyd was incredible. Where a group of people were saying, I feel protected by police. I feel like I am, supported by them, even though I have mental illness. And then others really having to stop and say, I don't feel the way that you do. So that's been my experience of it, both personally and professionally.
Awesome. Thanks for sharing that. And I'm so sorry for your losses as well. So sorry to hear about that. Anybody else want to jump in on that one?
Yeah. So Dr. Armah, I think that it's so important that you brought up your personal experience with your loss, because, it's one thing for us to see the numbers on TV and see 100,000 deaths, but it's another thing to hear the personal stories of our brothers and sisters. So my heart goes out to you and your family. And again, I think that's just so important for us because, it's easy to just look at the statistics and not realize the emotion and the people that we're losing in this particular situation. I'll also add that there's been a significant amount of hopelessness that the Black community has been experiencing. When we're thinking about COVID, we're talking about job loss. Dr. Armah, you brought up a great point about the economic loss. There's a lot of things that we are losing. Additionally, the outrage with the racial injustice. So a lot of us have been feeling hopeless and feeling like, what is it that we can do to help things get better? So I think that, us really acknowledging these different emotions that we are experiencing and us having these conversations will help us to begin that healing process. But there's, like you all said, there's a plethora of emotions that we're all experiencing right now.
Absolutely. Anybody else want to jump in with this one?
I think one of the other things is just that Dr. Shanda talked about is that hopelessness, especially in the African American community, especially with the racial injustice. It's just a lot of feelings of this again, we're going through this again. We just go through it every few years. We go through it every day. And then with the COVID, we know that it's affected African Americans at a higher rate. And so you just see a lot of people. And then with the job loss as well, there's already an economic wealth gap. And so with all three of those things, that hopelessness comes in. And another word that I've been hearing a lot from African Americans, just drained, because everything is hitting at once. And especially with this COVID thing, something we've never experienced, on top of the systematic injustices that we see, it's just so draining on so many individuals. And so a lot of people I don't think sometimes in this time, don't even look for help because they just feel like nothing's going to help them. And that's just a sad narrative to hear sometimes.
Yeah, and I think that comes from so much, right? There's been, we talk about these systemic things, in our society and the things that we've dealt with. We've also dealt with inequality and inequity and racism and discrimination within the mental health field itself. So the mental health field hasn't been kind of separated from these things. They've been a part of it. So it may not be naturally the safe space for us to jump immediately in when, generations before us and people currently have been impacted by policies, procedures, and, microaggressions and things that have come specifically from the system. So there's a part of it of just it not naturally being something that we engage in for a number of reasons. So it's not just, I think oftentimes there's this thing of, like we talk about help-seeking behaviors with Black people in mental health, and people kind of equate it to, oh, we just feel like it's not the thing for us, or like we don't try it. That's overall not 100% true. Like there are many stories of people who have engaged with the mental health system, looking for help, looking for a safe space, and have not gotten that, and have been harmed even further when jumping into this space. And so I think, to your point, and to you all's points, like it's definitely more than that. And one thing I'll share quickly is that I think another thing that I've seen is that I think a lot of us have had enough. Like, I think this was like, no, like this is, the fact that we as a people felt strongly to engage in battle systems right now in the midst of a global pandemic that's disproportionately impacting us, I think also speaks to the weight of the things that we've been experiencing and the desire to, have impact, because there's only so much weight you can carry, and I think, over time we've seen these things play out. And I think people were just, of all ages, really felt like it was enough and really have taken to the streets about this. Anybody else want to jump in with this question?
Yeah, another thing I've noticed is a lot of anxiety with a lot of my client population. There's a lot of reflection, a lot of time that a lot of my clients have been educating themselves on a lot of what's going on between the COVID-19 and situations with George Floyd. And then it's like a lot of true stories that's coming out that they're while researching because they're home and by themselves. And then there's a lot of false stories, and that causes a lot of anxiety that they're going through. And then there's a lot of shifts within family dynamics. A lot of things are coming up now with family trauma that's completely unresolved or that has been suppressed throughout the years that they're dealing with. And this social isolation has really done a lot to a lot of people, and a lot of surface from being home and not being able to go out freely like how we have been as long as I can remember.
Right. Yeah, this is all such a new space, for us. And so I want to kind of shift, as we're talking about, these different aspects of, systemic racism that have impacted us. I mean, there are countless examples of policies in different areas that have impacted us over time and have impacted our mental health and mental wellness. Like, I think that we, people kind of look at these things separate or look at them as so long ago and things that, really don't impact our population and our people right now, but they absolutely do. And so, like, there are so many different aspects to it of structural and systemic racism that have impacted Black people. And so I wanted to throw this to the panel, but in what areas of systemic racism do you find are impacting Black people the most, in your opinion? Like, which areas of systemic racism and which areas and which arenas do you feel like are impacting Black people the most?
I can share. I think, as a person who is chronically suicidal, I dealt with the criminalization of my mental health conditions. When I first attempted, I went upstate, just like I was going to prison. I went up an hour upstate in New York in Westchester to go to a hospital. And it was a terrifying place for me. I saw Black women being chemically restrained to the point where they can't speak. I saw, young Black men, a young Black man get arrested on my first night. And all he was saying was like, I hate the food. I hate being here. He said the same things that I felt, and he got arrested. And all of those experiences made me really upset, made me really frustrated, because I was coming from the streets protesting, that Black Lives Matter and going into this hospital. So I still had a lot of activist energy up in me. And so, I said, nah, like, this ain't cool. Like, it's making me worse. Like, we're getting mistreated. I don't want to be here. And, the nursing staff, who was, majority Black, because in the mental hospital system is almost like a plantation system where you have white and non-Black doctors implementing anti-Black racist policies. And then, the people who carry that out are typically low-wage workers who are Black nurses. And it's a terrible place where a lot of the Black nurses and nurse techs are not empowered to advocate for us because they're being rewarded to punish us. And so, you know, in the system, when I was speaking up and saying this isn't right, they physically restrained me, they threatened me with forced drug injection, and they threw me into an isolation room, which is practically a solitary confinement in the mental hospital space. You know, and I had a lot of privilege. My mom and my best friend was with me all the time, you know, advocating for me. And even with them, you know, I still experienced terrible treatment. The psychiatrist that I had who was non-Black told state Supreme Court judge, because in the mental hospital system, sometimes the only way you can get out is if you get a lawyer and you got to go through this court process, and it sets you up basically to fail. But yeah, on the stand, this non-Black doctor said that I would jump out of a car if my mom took me home. So, you know, Black people who deal with mental health conditions, especially those that are severe, we can get killed for it. Like, it's not a game out here. Like, so the Treatment Advocacy Center said that people with untreated mental illness are 16 times as likely to be killed by the police. So when we talk about, you know, stop killing us, when we talk about these things, that's a disability issue. That's a mental health issue. You know, we experienced the loss of so many Black people with mental health challenges being killed by the police, including Anthony Hill, Charlena Lyles, and also Tanisha Anderson and Kayla Moore, who was a Black transgender woman who got killed during a mental health crisis dealing with schizophrenia. And so I think it's really important as we're marching in the streets that we name Black folks with mental health conditions who are killed by the police. And I'm working with BEAM, which is a great mental health organization, to build a Black vision where we defund the police, and we're advocating for it to defund the police. And then we're advocating for a real reallocation of those funds towards Black community mental health supports, so that when you say that you're suicidal or you say you're having a mental health crisis, the first person you see is someone who looks like you, who's going to help you, and not the police. So this stuff is happening in the mental health hospital system, and it's something that we really need to talk about, because for people who are chronically suicidal, it feels like there's no safe place that we can go.
Yeah, Imadé, thank you for you know, sharing your experience with that. Like, I couldn't imagine what that was like for you, but just even unpacking some of that, like, you know, I couldn't, you know, imagine what that's like. And in so much of the mental health system, like when you talk about that plantation setup and organization, like that's so, you know, critical to how these systems, you know, maintain their function and maintain their ability to do this, right? Like it's set up that way, like, you know, by design. Like, so you're going there having, you know, already having these things as well. You go and see people that don't look like you, and the people who do look like you in those positions, like you said, like they're not empowered. Like they're not in position of influence and power to really advocate for you the way that they probably want to. Like, and that's the most distressing part, is that they probably saw it and see it and feel, you know, that inability to really impact it and to make change. And so that is so disheartening to see. And I, you know, it's so great to hear about the work that you're doing with BEAM and in that organization to, you know, to really put and get funds in places where we can have impact. I remember working in, when I worked in my previous position, someone on site, so there was a psychiatric hospital not far from us. Somebody actually found policy and document that talked about how to segregate the mental health services of the psychiatric hospital. Like, they found the documentation, like we all saw it, and it kind of like went, you know, literally like it's kind of stopped work for a day. Like we kind of like looked, like we all kind of looked at it, and we were a predominantly African-American staff. I mean, and people stopped working. Like, a lot of us left and went home early. People were in tears. I mean, like, you know, these things happen, and there they are in policy. And so now, like in some places, we've shifted off of the policy, but the structure remains the same and continues to harm. So I appreciate you, you sharing your experiences there. Open it up to anyone else who wants to jump in.
I just want to say thank you for, you know, for sharing that. I think it really, your story sort of highlights all of it. right? Because when you asked the question, Brandon, I honestly had a big smile on my face because I thought it would probably be easier to find the few ways in which our mental health hasn't been impacted, rather than to highlight all the ways that it has, because it's so pervasive, right? If you think about like, you know, Maslow's hierarchy of needs, like food, shelter, and rest, you know, in terms of all of the things that have been done over the years to prevent folks from being able to have those sort of basic needs. But then, you know, just thinking about like the small things that are not small, because it has such an impact on our mental well-being, our physical well-being, just like rest, just sleep, right? Like my patients right now, and over many years, right? I sometimes do require giving a medication because my patient is just like, you know, we've tried everything else. I want a medication so that I can sleep because I can't get a minute of sleep because I am struggling. I'm so distressed by all that is, you know, down on me, you know, so, but the food, shelter, rest, the security and safety, you hit that as well, right? So we can't even feel that we are necessarily secure and safe with the people who are designated to make sure that we are secure and safe, including the people who are taking care of our health and our mental well-being. So, you know, and then by also hitting, you know, the criminalization of mental health, as well as the criminalization of our race, right? All of that has such a tremendous weight on our mental health. And I just think you beautifully sort of highlighted that with your story.
Absolutely. Floor is still open if anybody wants to jump in on this question.
Yeah, so I'll say, I love this story that you shared, because being on the other side, as a person who has worked in an inpatient hospital, I can say that, you know, your experience is very valid. Like, people don't feel empowered at all, especially like the nurses and the mental health technicians, and those typically are the people of color. And then you have, you know, the administrative staff who usually aren't people of color who are making the policies and telling us to enforce them and implement them. So I think it's important for us to hear your experience, and also for us to have more people of color in those administrative positions who can make policies and changes and advocate for people of color, because at the end of the day, you know, it's not going to get better if we keep denying that exists, right? So one thing that probably annoys me the most is hearing that, oh, systematic racism, that doesn't exist. And one thing you know about anything is that we can't fix it if we continue to say it doesn't happen, it doesn't exist, right? And I always say that systematic racism is traumatizing for people of color. And one thing that you don't want to do to a trauma survivor is to invalidate their experience by saying, you know, it doesn't exist, that doesn't happen. So I think that us hearing your story and hearing how you live this out, the emotional experience that you experienced, the criminalization of mental health, I think that's so important for us to be able to say, like, enough is enough, and for us to begin to implement the policy and the changes that we need to in order to dismantle the structural racism that happens in mental health communities, especially for people of color.
Absolutely. Absolutely. Anybody else want to jump into this one?
I think like one of the things is, and thank you, Imadé, for sharing that story, is the thing of like the systematic racism is when I worked in the school system, so many things impact learning and children's behaviors in the school system. Inadequate heating and air is one of the biggest things, because a lot of the schools don't have adequate heating and air. And so that leads to children being irritable. And so some of them will act out because they're hot or they're too cold. Also,
Adam, I think we lost you. All right, so we'll wait for Adam to get unglitched. Kyle, did you want to jump in on this one while we work to get Adam back?
So I was on mute. One of the things going back to the question, one of the things I've noticed was housing, income, education, as Adam was stating, and employment definitely affecting our people. Myself, I live here in Baltimore City, and I've lived here basically my whole life. And I could tell you, a few years ago, back in 1999, I was working at Giant, and I was making $15 an hour there. So, and I was in high school. So was a lot of my other friends and colleagues that was in school. And today, here we are, 2020, and it's still a standard bearer making $15 an hour. And that has to have an impact on our people, like that, as far as that income, when you think about it, because what happened to the home ownership? You know what I mean? Because even then, as a high school student, I thought to make more. You know what I mean? Like, so how is it that we still wind up in this revolving cycle? You look at that, you look at education, graduation rates in high school or college, home ownership. You had a place called Bethlehem Still here in Baltimore that was providing careers for people that had a high school education, if that much, and turning them into homeowners. And there was a sense of pride in the community. Now you look around and you don't see that same sense of pride. You could ride down blocks over West Baltimore alone and see blocks of boarded up homes and vacated homes. And you look at how many people that you see that live in what's called abandonments here, which is houses that they aren't actually owned, but basically people squatting in, they have candles or whatever have you, or they legal wire it for lights, and that's how people are living. And you add that into what's going on right now with the coronavirus and the social isolation, there's no real thriving there. So those are 4 things I've noticed.
Yeah, absolutely. Absolutely. Adam, are you good? You want to jump back in and finish that?
Oh, all I was just saying is it's just that those things that impact education, and then like a lot of times administration would be like, I don't know why they act like this. I don't know why they act like this. And when there's so many things counted against our children and our youth, just in the school building, like I said, the unsanitary conditions, like kids can't drink out the water fountains in buildings. That was even the thing back when I was in the school system. So just those things like that. And like I said, the inadequate heating and air, a lot of the books and things like that are outdated. Those things, those children think that no one cares, and that this is just what's the point when everything that is in this building isn't adequate. And kids pick up on those things, and that leads to that frustration. So that was just to me, like the education system was just one way like that systematic racism impacts our children and their behaviors.
Absolutely, absolutely. And for those of you who don't know, Adam is my brother, and we're both products of Baltimore City Public Schools. And we probably, between the 2 of us, have stories for a whole nother session on that, and just how it impacted, on how the system impacted us. And it goes from funding to administrative leadership and where they pull the teachers in and all those things that impact us. So definitely could do jump in on that one. So I want to pull the conversation, and kind of following up with this question. So we talked about and hit on mental health, like we talked about suicide prevention. And so historically, mental health and suicide prevention haven't centered Black voices in its operation and how they've operated and sought to help. And they've done, the system itself, the industries have done harm, just to be quite frank about it. And so my question to the panel is, how do we begin or continue to shift this work into making it more for us and not against us? And what would that look like? Like, how do we begin to shift the mental health system, mental health services, mental health research, like all that stuff? Like, how do we shift these fields and the suicide prevention as well into being more for Black people and not against us?
I think like I look at it from 2 different ways. I think like one of the things is sharing our stories when it comes to that. I think oftentimes when you think about suicide and things like that, and it's always a white person on TV. It's a white person in the article. It's a white family in the article. And you rarely see African Americans on the forefront discussing it. And I think we have to really just like advocate for ourselves to talk about this is an issue among us. And we want to be heard when it comes to this issue. I think that's one of the things. And I think the other side of it is that we had to change how we talk about it, and saying things like, oh, Black people don't do that, or, oh, like they don't think about that. Oh, that's more of a white people thing. And like when you say like those small, like those statements, it makes that person feel like I can't share that I had these thoughts. I can't share that I've made an attempt. I can't share that I'm feeling this amount of hopelessness, and that is something that I want to share. But when you feel that you're not going to be believed, or you're just going to think that what you're saying is going to be overlooked, it's going to really hurt and affect that person about sharing their story.
Can I jump in there? Because you know, I think that this what you said is so key. But I have to say, you know, so I went to medical school and I was taught really that Black people generally didn't kill themselves. So like beyond what I learned in my community, like growing up, I went into medical field and that's what I was taught. And there wasn't a great deal of focus on it, really. And the truth we now know, right, is that the rates were starting to surpass white people, at least among the youngest of us when I was, you know, back in school, 2003, starting off. And just in children as young as age, you know, 5 to 12, right? And then while I was attending medical school, those numbers ended up doubling. And then there wasn't really talk about it, right? It wasn't until a bit later on, and people started to take notice later on. I have already gone through medical school, through 4 years of medical school, 4 years of residency, before people are starting, some people are starting to really take notice. Like in 2015, when Jeffrey Bridge revealed suicide rates for Black children in that age range, you know, being roughly twice that of white children. So, you know, I remember that just blowing my mind, because it was that wasn't what I was even taught as the medical doctor, right? So imagine that's what you're coming back from in terms of like your community, and this is what you're learning in school. And so it wasn't until I was preparing a talk for a group at church when I stumbled across that data. So it wasn't something that I was, you know, pushed out there among everyone, unless you know, were that day, you know, reading the New York Times. And so, you know, and then later on, you know, we found out more information about, you know, older kids in high schools. But, you know, the reality is that there were all these disparities that I knew must be there. I knew there were disparities in healthcare. But I wasn't learning that in medical school. I wasn't learning that in residency. I had to dig as I was becoming a psychiatrist to learn about the disparities in mental health and mental health care for Black and brown people. And there was really just not a significant number of Black psychiatrists to go to with questions. Honestly, there was one, and he was emeritus, right? So I think I saw him twice in the 4 years of being there. So, you know, it wasn't really until my 4th year of medical school's done, residency as a psychiatrist, that through national networks, I even really had any significant interaction with, you know, established Black psychiatrists. So I think radical change looks like more of us in the field of mental health, and accessible to the next generation of trainees at these academic institutions. It means the full incorporation of the fundamental challenges to Black people's mental health, and a focus on research to eliminate disparities, right? With funding dollars to match, including really a deep dive into the factors that are related to resilience within the Black population. And it means to me not keeping Black people out of the dialogue, and actively and purposefully including them in the implementation of interventions. So radical change would see a rapid decline in suicide, and would include interventions to address the racial discrimination and infrastructural barriers to good health care, because of the impact that they have on the mental health of Black people. So that includes the food deserts, education, housing, police brutality, employment, wealth generation. And with radical change, we would see a greater engagement in mental health care seeking, I believe, and improved care when we reach for it, right? So, you know, you really highlighted that, you know, not really getting the care that you needed. So not just when you seek out care, that you seek it out and you get the adequate and actually high quality care that you really deserve, and then better outcomes when we fall victim also to chronic disease physically, because as we know, there is that mind-body connection, right? So improve mental, physical, spiritual health of Black people, and I would say as evidenced by lower rates of hypertension and diabetes.
For sure, for sure. Anybody else want to jump in to that?
Yeah. Sorry, go ahead.
Oh, okay, so many folks want to speak. Which,
Imadé,
let me just blurt in. I'm sorry, y'all. Yeah, I think that we really do need to center the most marginalized people, especially in the Black community, when it comes to suicide prevention campaigns. And just from what I've seen through the surveys, Black transgender folks are really at ground zero when it comes to the suicidal crisis. There was a 2015 survey that said basically that 47% of Black trans folk have attempted suicide in their lifetime. There was another survey that said that 1 in 3 Black trans youth have attempted suicide in the last year. And I think that advocates like myself, we need to do a much better job at centering the mental health needs of Black transgender folks, because if these statistics were happening to cisgender Black men, we would not stop talking about it. So I think that for mental health campaigns, we really need to center Black trans folks. I think another thing that we can do is just have Black patient-led mental health treatment. Because I think what happened in my particular situation is that it wasn't a representation issue, not necessarily, in the sense that, they're all Black nurse techs, and even the head nurse that actually triggered me and caused me to, be really frustrated was actually a Black woman. And so I think that we do need representation for sure, but these Black folks need to be putting our mental health first and need to allow us to lead the treatment, because we are the experts of our own mental health experiences. And so we know best how to heal ourselves. And I think that when it comes to suicide prevention, people with lived experience with suicidality, we need to be the ones talking, because we use these suicide prevention services. And I can tell you that, as a frequent flyer of all these suicide prevention services, that some of them are not good. Some of the counselors give us trivial support. They'll tell us to go for a walk or read a book. Like, they don't understand what chronic suicidal ideation is like. It's a consistent, ongoing thing, and you can't always do just one thing to make it go away. And we need ongoing support. I really, really celebrate the peer support warm lines. I think that these are lines that are not necessarily hotlines, but they are phone numbers that you can call before a crisis. And the people that you talk to are people with lived experiences. So they're giving you wisdom from their own life and talking about their own situations. Some of them have been homeless like you have. Some of them are trans, queer like you, and it's really helpful for me. And also, it's not connected to calling the police on you. I think one of the first things that we need to do, especially in like Black clinicians and in our Black communities, is to not call the police on suicidal people. I think that is something that is highly traumatic. And I had a great Black therapist, and I still believe that she is a great therapist. I totally believe it. But I told her that I was suicidal. I took a nap, and I woke up to 2 police officers at my house. It was the most terrifying thing I've ever experienced, and I didn't know if I would survive. We need to really not call the police on us. I think there are better ways to intervene when it comes to suicidal folks, and it all needs to be consensual. And I really appreciate Trans Lifeline. They do not do non-consensual active rescue. They also do not call the police unless the caller specifically asks them to do so. And then you have Cahoots in Oregon. They have set the model since 1989 for mental health crisis intervention. I believe they had like maybe over 20,000 calls in their 30-year history. And they've only, I think, had called for police backup 150 times. So we know that, models like Cahoots, where they send an EMT or a nurse and experienced mental health crisis counselor, we know this works. These services have been implemented for such a long time. And I think that one of the first things that we need to do when it comes to suicide prevention and for mental health crisis care is to implement this Cahoots program like across the country. And it's encouraging to see that Oakland is trying to do that. I believe Denver is trying to do that. I think what's happening now is we're seeing a nationwide call for the defunding of the police. And what's that happening is that it's reaching its tentacles into the mental health movement. And so now we're seeing people looking outside of police forces for the care that we need. So even though I talk about a lot of bleak stuff and it's really hard to hear, this is actually a very exciting time for suicide prevention. We're seeing a completely different language being used when it comes to mental health crisis and mental health crisis care.
Yeah, I definitely agree with you there. I think we've had conversations that we haven't had before, and I think it's really critical when you talk about that. Calling up the police thing, like that can absolutely be so traumatic. And it's been so many stories in the names that you read kind of earlier that really talk about people who have died in mental health crises because the police have showed up. I actually have a good friend of mine who lost her brother, a Black man. The police showed up about 4 or 5 deep, I think. I mean, guns drawn, just guns drawn. He was having an episode, and they killed him. And from what I understand, it was pretty quick. Like, it wasn't, the intervention never happened. Like, there was never an intervention that took place. And these were officers that were, supposedly, trained. And, I think it really, speaks to what you're talking about, of us thinking about suicide prevention differently. And just run real quick soapbox thing. Like, I value greatly, lived experience. Like, I struggle with anxiety, and, but I, haven't, made a suicide attempt. And there's so many people, in this space, and we try to bring in lived experience, but it has to be like complete and representative lived experience. Like, even in the small, there's like suicide prevention experts that kind of like, run everything that kind of happens in suicide prevention. Then you get to this box of around suicide prevention, people with lived experience. And then suicide prevention, people with lived experience that are Black or a person of color, I mean, few and far between that actually have their voice in position to move intervention and make change. And so if we don't do that, and it's not inclusive, like, there's always a thing of, we have to keep drilling down. And like the last thing that gets accepted is having Black people or people of color like at the table. And so it's like, we drill down, we finally starting to listen to people with lived experience, but we don't have the right representation there as well. So I appreciate your points there. Anybody else want to jump in with this question?
Yeah. I didn't hear you. Okay. I was going to say, we need to really have the ability to identify our voice. As a people, we're separated by class, race, color, where we live, sexuality, and in some cases, employment. So we need to really gain an understanding of our experiences. Many of us have different experiences because of those things I just named, and work towards building a platform off of that. Identifying trauma and really coming to understanding that our trauma is and should not be a cultural norm. We have to come to a real place where we reduce stigmas amongst our people when it comes to mental illness. And by that, we have to start actually having actual outcomes with mental health care in a lot of cases, instead of just moving right along. While teaching that, we also have to educate a lot of people in the community that seek us that a lot of things don't happen overnight. And just to big up Morgan, I think schools like Morgan that teach the urban perspective in mental illness should be leading that charge.
Yeah, I 100% agree with you. Agree with you there. And in thinking through that, I think having us at the table to one be to make sure that the funding that comes in research is actually distributed in a way, in an equitable way, so that we don't keep creating intervention and prevention strategies that only fit one select group of people. And even making sure that we are the ones developing the interventions ourselves. So not just necessarily being representative in research that's looking at interventions, but we can create them. Like, we have the experiences, the talents, the abilities to create these on our own. Like, we are the answers that we're looking for. But, if we look at the way things are divvied up and who gets the funding and who doesn't, like that's one critical piece of it. And so it's definitely something that we need to, look at, and then just build and resource internally. I think that, the also other thing about it is that, when we come together and galvanize, like, we can create things on our own. Like, we can look at, HBCUs and other organizations, like, we can start to build our own infrastructures in here and not wait for people, to force people to listen to us. Anybody else want to jump in with this one?
I just want to highlight the fact that it's got to be multifaceted, right? So it's not, there's no one size fits all. And so if we're all putting in all of these pieces, we're actually going to have that impact. Yeah.
Absolutely.
Yeah, really quickly, I just want to say, to Adam's point, I think normalizing like suicidality in Black communities, I think that's so important, because like you were saying, like for so many years, we've been looking at this as if it was just a white person's issue. This is just something that white women experience, and the research actually suggests otherwise. So, Black teens are more likely to try to engage in some sort of suicidal behavior more likely than their white counterparts. So I think, us looking at the research and normalizing it amongst our community so we can actually start to facilitate the conversations is going to be so important, because historically we have a strong history of embodying the strong Black woman, or, John Henryism, trying to persevere through the pain. And that's just not productive, right? And somebody alluded to the fact that just because we normalize to it doesn't mean that it's functional. So I think it starts at home. Like, we really have to start having these conversations amongst our community about suicidality, what that means. And that way we can actually get to a place where we can start to implement some of these different treatment designs and protocols that might benefit our community.
Absolutely. Yeah, I totally agree with that. And having those conversations is so critical. And we just got a comment that really talks about that as well. But it's so critical that we're able to do this and have this conversation. So I want to jump to this. We started to go into this, but, we talk about Black Lives Matter. We talk about our community, and there's so many different pieces of the Black experience, right? Like, so it's not just, Black people in general, and there's just us, and, there's so many different aspects to us and to our existence. And so Imadé already talked about Black trans women not being represented in anything that we're doing in suicide prevention. Are there other subsets of Black people that the field itself hasn't looked into or given voice to that we really should think about? And mine personally is Black mothers, like, as they're going through pregnancy and giving birth, like dealing with postpartum if they get that. But Black women in healthcare, if we want to talk about systemic racism and how that impacts our people, low birth rates, Black women die giving childbirth more than any other demographic, which is absolutely ridiculous. I won't get on my soapbox of that. But are there anybody else that we really need to consider as well with the field?
I would say it would be beneficial to focus in on the Black incarcerated population, because, somebody had said earlier that Black people make up about 75% of incarcerated people in those criminalized systems. And I think that it's important to point out the fact that not only are we more likely to be incarcerated, but those who are incarcerated are more likely to experience mental health outcomes or mental health diagnoses, such as depression, anxiety, suicidal ideations, and those different types of things. So the more we emphasize that, I think the greater the emphasis will be on the treatment of incarcerated people so that they can get the adequate treatment that they need, treatment that is evidence-based and for our people. Because one thing that we can't continue to do is to ignore the fact that these numbers are disproportionate, because then they won't be getting the treatment that they'll actually need that will help to benefit them. So I think that's really important. Also, looking at the homeless population. So 45% of homeless individuals are Black people. And again, those who are homeless are more likely to experience mental health diagnoses. So that's just another population that I feel like is often overlooked. And we need to definitely just put more of an emphasis on it so that we can begin to heal as a people.
Absolutely. I agree 100%. Anybody else? We'll take one more, and then unbelievably, we're almost out of time, which is crazy. But anybody else want to jump in on that question?
I would say substance abusers as well. Yeah, I know homeless was just mentioned. I would also say substance abuse. I understand that now opiate addiction is now being taken seriously by other people. But I don't know why, but crack cocaine addiction is still not taken in the same light. And even in the urban community, I think that's a voice that kind of got drowned out and is slightly being left behind as opposed to some other populations as well.
Okay. So we've been given the green light to go a little over if we need to. So I'm going to throw this other question out there because we have a little more time. So thank you all for those experiences as well. So the other thing I wanted to check in with you all about, so like to fight, title of this Fighting While Healing. And again, we as a people find ourselves on the front lines of battling systemic racism, discrimination, breaking down these systems, seeing our people dying on video. It's tape for us to see. It's traumatic, and we're back in this place, right? This place that we find ourselves in far too often, and that we're battling. And so at the same time, like I said, I thought it was and you all talked about it, but it's such a juxtaposition to look at how we were dealing with COVID-19 and tracking those numbers and, looking at grief and loss, and then having to go out and collectively mourn someone, multiple people. Again, Breonna Taylor, George Floyd, Ahmaud Arbery, just a small list. I'm from Baltimore. A couple other panelists are from Baltimore. We had Freddie Gray. And so we find ourselves here again, and we never quite get this opportunity to heal, right? We're always jumping from like one fight to another, one battle to another. And so often we don't get that opportunity to heal. So like, as we're all fighting in our own spaces, as we're advocating, as we are, being activists and in this time where we really need to, how do we also do that and heal at the same time?
I think one of the things we have to do is reach out to different people and reach out to other people and ask them, like, how is this affecting you? And I had a conversation with my parents when George Floyd happened. And my mom asked me, well, how did you feel watching the video? And I told her I couldn't watch the video. To see a man get broken down like that, and to the point where he was so vulnerable, he was calling out for his mother, and that lasted for 8 minutes and 46 seconds. I couldn't bring myself to watch something like that. I just couldn't. And to have that conversation and to feel heard by my parents, it was like, oh wow, like it really did affect you. Like, that's terrible how that affected you and things like that. And then even like on top of that, as a Black man, that George Floyd, that happened to him over a supposedly counterfeited bill. I go to the bank a lot. I still use cash all the time. And that made me feel like, dang, like that could be me in that situation. And just having these conversations and just checking in on people, I think is one of the, just starting, like we always say, like it starts in the home. I just think like just checking on our inner circles, our professional colleagues, our friends, our families, even like if you're a therapist, like your patients, and just asking them like, how is this making you feel? And I think once we can kind of start knocking down that barrier and giving people the opportunity, just opening up, I think that's a small step, but I think it's a step in the right direction.
Yeah, the other thing with that is that, one of the things that was brought up early on in our conversation was this sense of hopelessness about, we're doing this yet again. But I think one thing that's important is to highlight what forward movement happens because of our fight, to recognize that, and to not end up falling into this sense of hopelessness, because in fact, what we did 20 years ago, 15 years ago, 10 years ago, 5 years ago, each time did have some forward movement. And this time, which really seems very unique, many people who, I think we have to have historical background. We don't have anyone online. I don't know, I might be the oldest one on the line here. But, folks who are even older than me who went through civil rights movement, can say that this really does feel different than what we've seen over the course of this past several years with violence against Black people. So I just sort of want to say that on the side, but I also want to say that the act of fighting itself is also healing. So as we advocate for our rights, there are studies that show that there's an accompanying protective effect, right? That can combat the very thing that's brought us here together today, right? Which is suicide. And we have to be aware that the work that we do and bringing these issues to the forefront will have to continue to be sustained if we're going to continue to see change, really without becoming discouraged. So, I mentioned that there's a little study. So we need to take maybe some notes from some of these studies, right? So like Native Canadian communities, when we look at what's sort of maybe needed for our community to combat these rising suicide rates. There's a study that was done in 1998, and I didn't know about it until more recently, that investigated while some Native Canadian communities show rates of suicide 800 times the national average for suicide. In other communities, Native Canadian communities, they really, like, suicide is essentially unknown. And when they look at the differences between the groups, and they really broke it down, they saw that there were lower rates of youth suicide among the groups that were participating in and practicing collective efforts to preserve and rehabilitate their cultures. And they were fighting the government for titles to their land, rights to self-governance, control over services like education and healthcare and police and fire, right? Sound kind of familiar, and having to really ask for things like buildings for cultural activities. And I think this really also hints to the need and importance for social support and strong positive impact of religious engagement that's been seen in studies as really combating the damage that's done by racial discrimination.
Absolutely. And that's why we got a comment that said advocacy is self-care. Absolutely. So I do, I definitely agree with you there. I feel like there are some days I think, in doing this work and fighting, like you can feel burned out, but I feel like there have been, different spaces and the number of hats that I wear, that there are days that, we have really uncomfortable conversations because that is the conversation that needs to happen. And so when we do that and when we happen, like I noticed like there's this thing, these couple of things that happen that drive me crazy. So like there's this one thing of like we're in this, thing and people are saying things that, are problematic like in these spaces, and they may or may not realize that it could be, microaggressions, micro assaults, what have you, but they're not really understanding it. So, I have to jump in many circles. I'm maybe one or two, Black people in the room, and definitely oftentimes the only Black male in the room. And so like, we have to course correct, like I have to jump in and say it. And there's always this like hush of silence. And then the next immediate response is always the one to try to like calm me down in that sense. But it's like, I didn't, raise my voice or do anything like that. It's just really like getting to like, we have to, address and deal with these things. And on those days, it does feel great. Like it feels like we're, like I'm pushing something that, could eventually have change. So I totally agree with you there. Any other thoughts about this?
I would just say while we're having our therapy visits with our clients, just normalizing this conversation, because trauma should not be our culture. I don't believe that it is. And we should definitely fight against this being our culture. Like we have family members, we have friends, we have clients that survived this Jim Crow era. And we should feel comfortable with having these conversations to see what were their lived experiences going through segregation. I had the privilege of speaking with one of my clients about a month ago now, when the George Floyd death was fresh. And for a long time, for a couple of years, I was seeing him, and he constantly mentioned a lot of apprehension he had towards white people. But in one of those sessions, it came out about a lot of things he experienced, from having water hose sprayed on him, being hit with a flapjack by a police officer. And we just really dived into it. And it changed the whole dynamic of my treatment of him, and even how he's improved, because we don't really realize a lot of things that, we go by textbook, we go by all these different books that we practice out of and all these different models that we practice out of. But a lot of things that we're dealing with, we've made a culture of. We've made so regular, like just of being oppressed, redlining, being in poverty, being a Black man or being a Black woman in this country. And there's a lot of trauma and a lot of burdens that come with it, but we've normalized it to the point that we just, it's taboo to even talk about it. And I think we have to start diving into those conversations now.
Yeah, I agree with that. Any other thoughts on that?
Yeah, I just want to say, I think that being an advocate and advocacy, protest, all that stuff is great. And it can be healing. And also it's important to just check in with yourself. It's okay to not have days where you're not feeling like protesting, or to have days where you have to set conversational boundaries with someone because you can't talk about, George Floyd, Ahmaud Arbery, and Breonna Taylor, because, a lot of times we might get caught up in the advocacy to the point where it becomes exhausting. Dismantling white supremacy is exhausting in itself. And constantly fighting, period, can be exhausting. So even thinking about how we're discussing racism and racial trauma and transgenerational trauma and all these things that our ancestors experience, our parents experience, that we're experiencing even today, it can feel like it's a never-ending battle. So that's why it's really important for us just to constantly check in on ourselves and to make sure like we're good. It's okay to take breaks. It's okay to turn the TV off and not be on social media for a day, just to make sure that you're in a healthy space emotionally.
Yeah, I definitely think that's key. My friends and I, we talk about being able to sub out, like, playing sports is like, the day, like, I'm doing this, I'm in this space, like, I'm making it work. And it's like, you got to jump in. Like, I can't do it today, bro. But like, spend that time with like, family, like kids and stuff like that, and get recharged. And then when you're able to like, to jump back in. And then I think that's another, you bring up a good point. I think that's another impact of like battling, white supremacy in this space, is that you can feel like you're not doing enough. Like, you're never doing enough. Like, there are days where I feel like, in my position, like I'm saying this, I'm writing this, I'm battling this, I'm breaking down policies here and trying to do this stuff. And then I'll look and see things and I'm like, I feel like I'm not doing enough. And, it takes somebody else to go, yes, you are. Slow down. You're giving as much of yourself as you can. But, what we don't want is, for us to be battling this so aggressively that, we get burned out, that we suffer as a part of it. There are enough of us in this fight together that we can, band together and do some good lane work. Like, we each have like things that we're really good at, and empowering each other to stay in the fight and do those things. Anything else on this before we wrap up?
I just want to say that that end of it felt like my group therapy session that I've been needing. So, it just rings so true. Thank you both for those comments.
No problem. So this is a great conversation. This has been awesome. And I mean, I appreciate you all so much. And so what I want to do and how I want to wrap up is to really just go around, give each of you all a minute to 2 minutes, since Rudy is kind enough to give us some more time. Like, just, we have this platform and this message that we can share tonight. And so I want to give each of you all 1 to 2 minutes to say something to the field. Like, there are so many different people that are watching this, many people in spaces of influence. Some of them have lived experience. Some of them are advocates. Some of them are Black professionals. Just your message to the field. Like, if you want to say something to mental health and suicide prevention, you have your captive audience tonight. And I want to pass it to each of you, just 1 or 2 minutes. Say whatever is on your heart, whatever is on your mind. If it's something that we didn't cover, address it. If it's something that you want to hone in on, do that. However you want to use that space, I'm going to yield that to you all. And so I'm going to start with Tichianaa. I'm going to start there, and then I'll call on each of you.
I was trying to be quiet, so I was thinking I'd mute for a while. Okay, so I would say, really just sort of summing up, is that we We need to be creative and not try to use a one-size-fits-all approach to addressing suicide prevention within the Black community. I think there's a tremendous amount of resilience in our community, and we need to tap into that to combat the rising suicide rates. We also need to support activism and empowerment of the Black community and families and children, and contribute to the efforts that increase cultural pride as well. We need to partner with other organizations, institutions, and community resources, including Black churches. And yes, to increase awareness, but also to take that next step of creating and implementing interventions really with solid outcome measures. And where those outcomes are positive, replicating them widely. You know, I was listening one day to NPR to the description of this really excellent program that was reducing the recidivism of back to jail for Black men and fathers, specifically by linking them up with companies, community services, as well as churches to support these young men. And so, you know, I was driving along and I stopped my car so that I could feverishly jot down information about the program, only to find out that it was across the country. And it didn't sound like there really was any kind of chance or opportunity that it could end up benefiting the father of an adolescent client of mine. So I really think that we really can't afford to let positive and impactful interventions go unnoticed, underfunded, and unsupported. And they really need to be embraced, researched, and implemented broadly. And in the long run, really everyone wins.
Awesome, thank you. Kyle.
I'm just going to piggyback off of Dr. Armah. We just really need to push for a true person and environment system based off of data that truly identifies our culture and our different subcultures. And like Dr. Armah just mentioned, one size fits all does not work. We've tried to force that for years, and we're where we're at today. And we really need to identify each person in the environment, like each different culture, each different subculture, and really get to a results-driven perspective and practice.
Thank you. Adam.
I'm a piggyback off of Dr. Armah and Kyle with the results-driven data and everything like that. A lot of times with the data is always, well, how many? But they never really look at like what worked or what were the outcomes with certain people. The people who were successful, they never look at, well, what was successful with them? It's just like, well, how many? And I think that's one of the things we have to be flexible in our approach. Like you said, it's not one size fits all. We always have to be flexible. And I think we also have to be learning to just adjust on the fly, because something that may have not worked once before may work later on, and just things like that. And another thing is, I think, is we just need more African Americans in the mental health field. When I work with multiple organizations, usually 90 to 95% of the organizations were white women, white clinicians. And but they were in communities that were serving predominantly African American youth. And so it always bothered me. I was like, I think a lot of times they need to see us. They need to see that we care for them in this realm of their mental health. And I think once they see us, they feel more comfortable with us. And I think that's one of the biggest things that we can help break down a lot of these disparities. If there's more of us in the field and doing the work, and there's more of us advocating, I think it will just make that process that much easier. And I think once we have those strength in numbers and people who are truly African American, truly passionate about mental health and want to help out our communities in so many different aspects, because there's so many issues, I think once we can do that, I think we can be unstoppable.
Awesome. Shonda? You're on mute.
Oh, hey, y'all. I'm just going to echo my sister, Dr. Armah, who said it best, looking at, the church and how we can collaborate with the church in order to make sure that we are addressing the needs of African-American people in the church, because the saints get suicidal too. And I think it's important to acknowledge that and to not kind of just like brush it under the rug, like, oh, if you believe in God, these aren't issues that you suffer from. But no, we have to actually look to see how we can collaborate with churches in order to really do what we need to do in order to effectively communicate the importance of mental health, and looking at these different resources and protocols in the Black community, especially when we're collaborating. Additionally, as an adjunct professor, so not only do I identify as a clinician, but as a person who's just like a strong advocate for education and really wanting to dismantle white supremacy from the classroom, I think it's really important for us to acknowledge that psychology, the foundation of psychology, is very westernized, and it was built on the backs of individuals who strongly believe that Black people were inferior to white people. And a lot of the theories that we teach our students in the classroom are by people who had racist ideologies. So I think that, as a professor myself, I don't care if I'm teaching statistics, group therapy, if I'm teaching Psych 101, I'm going to talk about how systematic racism has dictated the psychology field in the specific subject area that I'm teaching. I think that's so important for our students to hear. And also really acknowledging the fact that, we're done with diversity. Like we had enough of that in the education sector. We're not talking about diversity anymore. I think it's really important for us to talk about anti-racism and how to be culturally sensitive, because, diversity is cool. I think Angela Davis said it best. Diversity is cool when it comes to businesses and looking at how we can operate in the corporate world. However, when looking at issues of social justice, when you're working with people, we have to really recognize that it's more than just diversity. I have to do more than just acknowledge that you're a Black person. I have to see you. I have to recognize that you're experiencing prejudice, discrimination, and look at things from an anti-racism perspective. And I think if more educators, professors, teachers, whoever you are, really took the time to really study this information and to teach our students, I think that'll do us a service when in the future, when these individuals are out in the field and we have people who are presenting to them from multicultural backgrounds who do come into the room with not just their diagnosis, but their skin color. So I think that's so important on so many levels.
Imadé.
Yeah, thank you for sharing that, Dr. Chanda. I really agree. I think we definitely need to be focused on anti-racism and systemic inequality. I am really over suicide prevention campaigns that only talk about stigma. I think that is just one portion of the issue. I believe that we are dealing with systemic inequality, and these suicide prevention campaigns need to do that. They also need to stop individualizing suicide prevention and putting the onus on the person who is in crisis to ask for help, because we would not expect that of someone who's having a heart attack or a stroke. We would not expect them in the middle of their crisis to say, hey, ask for help. We would expect that people who love them and support them and who see that they need help consensually intervene. And so I'm really exhausted by these ask a friend, tell a friend. Like, I think that that's not enough. I think that's putting a Band-Aid on a very deep wound. I think that we really need to start talking systemically about how we can support people with suicide prevention before they're suicidal. I think we need to move into a preventative model where we don't wait until people reach their rock bottom to give them help. I think also what we need to do is, clinicians need to have more training when it comes to suicide prevention. There was an article that recently came out that said a lot of clinicians, they don't have a lot of suicide prevention training. And that's pretty terrifying, that the person that I trust in the middle of this, really vulnerable and really scary situation doesn't have the training. So I think there's so many things that Black clinicians can do right now to support their clients. They can not call the police again and utilize other services, and they can also just get that suicide prevention training so that they can be a better service to their clients. And I think the last thing is I echo the disability justice movement where they say nothing about us without us. Suicide prevention training should center the experiences of people who are suicidal. It shouldn't be a situation where we talk about these services and we don't center the actual people who use the services who can actually properly evaluate if they're useful or not. And I think there's a lot of ways that folks can join and can be activated and be engaged in this moment to help Black suicidal folks. You know, I mentioned the campaign that I'm working with. You can go to beam.community/Black Vision. It shares the demands that we have for Black folks that are in psychiatric jails and those that have been released. You can also donate to my program where I give Black-affirming personal care items to folks in mental hospitals. This is something that you can do easy. Just give me, you know, drop $5 and I can buy a satin bonnet for someone. I can buy a wave cap. I can buy a Y2 comb. I can buy these things for Black people who need to feel like they're being treated with dignity in these places where it can be so punitive. So there's so many different things that you can do to get involved. And I just say, you know, yes, it's really bleak, you know, to clinicians and also to clients as well. It's very bleak, but there are so many ways to get involved. And, you know, like was said in the comments, you know, advocacy is self-care, and advocacy is also a form of community. You can actually find your tribe. You can find the people that you connect with and you love the most through advocacy. So I would just say, you know, don't be discouraged. Join the movement.
I should have went first. So, I mean, I think my message in wrapping this up is really, you know, for the field, for mental health, for suicide prevention, to understand where you are positioned and use that position to make influence and to address these things. It's not enough, you know, for our allies. It's not enough for you all to, you know, kind of say and identify as not being racist, and continue to benefit from the racist system and from the systemic racism and watch these things happen to other people, to Black people, people of color, and not intervene. And so, you know, talking about that anti-racism piece, like it has to be embedded in that. It has to be a part of dismantling these things. Suicide prevention is still, you know, dominated by white supremacy. And so advocating and pulling those structures down, changing the way we look at interventions, change the way we interact with people of color in mental institutions, from training our clinicians in suicide prevention, because that's a great point. And it's very true that clinicians just aren't trained, but they're on the front lines of this. And so making sure that training is there. It's not just enough to be culturally competent. I don't know if there is a way to be culturally competent in someone else's culture. You can demonstrate cultural humility and really get to the point of engaging that person as a full human being with their full experience, not just the experiences that you are comfortable in talking about and in engaging with, but being open to having conversations and learning about things that may make you uncomfortable in order to be able to help a person that doesn't look like you. For our people, for all of the Black professionals watching tonight, we appreciate what you're doing. Continue to let your voice be heard. There are so many things that stifle our voice, that don't allow us to get the things out or have the influence that we want. And it's there by design. Just know that what you're doing is helping someone. It is benefiting someone. Continue to speak out. Continue to reach for those leadership positions. Continue to get in spaces of influence. And bring the experience of your friends, your family, your colleagues to the forefront, so that you can advocate for them. And just know that there are so many people in this fight with you. All of us, all 6 of us are in this fight. We all have our Twitter handles around here and stuff. Like, engage with us, like, you know, talk with us. Like, we're building community right now to really break these things down. So continue to not let your voice be silenced. You are doing amazing things. And just to any Black person that may be watching this who may be struggling with things, there's community for you too. Like, we're building spaces for Black people to get the support and the services that they're needing. Depressed While Black and their connection to Beam and what they're doing is amazing. And I think, Imadé, that's pinned to your Twitter, right? Like, that tweet with Beam, I think is there, right?
Yeah, it's pinned on my Twitter. You can go to also to depressedwhileblack.com and get to the site that way. But yeah, me and Beam, shout out to Yolo Keeley, the founder of Beam. Like, we are really trying to focus on Black folks incarcerated in psychiatric jails and punitive hospitals. We are trying to go beyond the locked doors of the facility and pull these stories out, bring it to the center, because the cruelty and the anti-Blackness that have existed in those places has happened for far too long. And so we are talking about some really deep and interesting issues, and it's so great to experience the support. Black clinicians, they've been getting involved. We also have a committee that we're trying to form, and we've been having so many Black clinicians want to get involved on this committee to help dismantle racism in the mental health field. So yeah, you can also go to either my site or go to Beam's site, beam.community/Black Vision, and sign up for the committee. And it's been the movement has really been growing.
Awesome. So jump in there. There's ways to support that initiative. Go download Minds of the Culture as well, and get that app and look at the supports that are there, and keep your push notifications on, because something's sent out like every day from the app to engage with people. Roberta's house does great things with around grief, and we don't talk about that enough. There's more than just grief and loss of an individual. As Black people, we've lost so much. We've lost culture. We've lost the ability to provide for ourselves. I mean, just look at Black Wall Street and some of the things that we can mourn that have been stripped from us. And so anybody watching, there are people in spaces that are thinking about you, that are working on your behalf. Continue to reach out, continue to connect with us. We're here for you, and we are pushing and fighting these systems as well. And so if you all want to connect with us, our Twitter is in all of the posts from SPSM. And so I want to thank Rudy again for giving us the opportunity in the space to really have this conversation. Rudy reached out to me and allowed us to have full creative control tonight, and even extended our time. And so I want to thank him for that, and for him allowing us to do that in the way that we thought was best. And so with that, since we're like 27 minutes over, I will shut up, and thank you all so much for your time and your energy. Thank you for my panelists. I love and appreciate each of you all as my brothers and sisters, and Adam as my literal brother. But I appreciate you all and what you all brought to the table tonight. And so with that, we'll go ahead and sign off.